Okay, so since oxygen is the most important substance, well, one of the most important substances in your body to allow you to live, um, in the hospital, it's really important to doctors and other health professionals, nurses, and anybody else who takes care of a patient, whether or not that patient has enough oxygen in their blood to run all their organs and keep all of their metabolic systems running correctly. And so this used to be a really difficult process. We just have to look at people's skin and see if they turn blue, or we'd have to poke them with a needle and suck blood out and send that blood to a lab and get it tested. Until the mid-1990s when this technology was developed. So these sensors are disposable. They are single use. You throw them away once the patient's used them. And usually they only last for a day or two. They don't have a lot of life expectancy. So you plug it into them.
The nurses told me they didn't like them.
Yeah.
And that if one of us could, make one that worked better, they'd appreciate it.
So the way it works is you plug it into the monitor here. So you see two different little parts to it. So one is this emitter. So that emitter is shooting out red light in the red spectrum, that's why you can see it. And then it's also shooting out infrared light. And the reason it does this is the hemoglobin in blood cells reacts differently to these two different wavelengths of light, whether depending on whether an oxygen molecule is attached to it. So you take the sensor off and you put it on somebody's extremity. Usually it's a finger, sometimes a toe. Sometimes we'll put it on people's noses or ears, something where the light can shine all the way through. If you can see the side cut from my finger, the light's shining all the way through my finger and it's getting picked up by an emitter on the other side. So if you look up at the monitor here, you can see that's what the readout looks like. And so this little pulsatile trace is called plasmography, and that shows that I have a pulse. We're specifically interested in arterial blood because that's the blood carrying oxygen to tissues as opposed to away from tissues. And so the oxygen content of that arterial blood is what we're measuring here. And so what this little computer does is it picks up the infrared light and the red light that goes through to this emitter, and it takes the percentage of blood that's oxygenated by it figures out by the amount of infrared light that's absorbed, and the total percentage of sorry, I got that backwards. So it takes the total percentage of light that's absorbed on the infrared spectrum, and then it divides the amount of oxygenated blood, and that's determined from the amount of of light that's absorbed on the red spectrum. And when it takes that fraction, that's the fraction that shows up here. So my blood currently on room air while I'm talking is about 94% saturated with oxygen. And that's pretty normal for an oxygen saturation. If I breathed in some extra oxygen through a mask, it would go up probably to the 98-100 range. So because of the way oxygen separates from hemoglobin, once this gets around 90 and people aren't getting enough oxygen, it tends to descend really fast from there. So usually what happens is a nurse or any other medical professional that's monitoring the patient will watch this number, and if it starts to sink, then they usually apply some oxygen apparatus, a mask or a nasal cannula, something to give the patient a little extra oxygen to put more oxygen in the blood. That's pretty much it.